We acknowledge the traditional custodians of the country where this video is filmed and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples. Aboriginal and Torres Strait Islander peoples should be aware that this video may contain the images and voices of people who have passed away. Breast cancer is the most commonly diagnosed cancer in Aboriginal and Torres Strait Islanders women. It is the second most common cause of cancer death in Aboriginal and Torres Strait Islander women after lung cancer. My name is Janice Rigney. I'm a Boandik person from the lower southeast of South Australia. My experience was a few years back when I was working with a lady in my hometown. That's the first time I ever heard of breast cancer. I'd never touched any of our families until a few years back. I had a cousin that was diagnosed with breast cancer, and she lived for a few years actually. She went into remission, went on holidays with her daughter, cruises and you name it. Sadly, after a few years it did take her in the end, yes. It made us sit up and be aware of having breast screening done. I remember having my first mammogram, I believe I would have been in my late 40s, if not early 50s. So I try to encourage women now to go along and have it done because it's very important. I think it's important for any woman over 50 to go and have one done. If it does occur, okay, thank goodness I've gone and had this done because, if you get it early, there's every chance that you're going to survive it. It doesn't matter what age you are or who you are. You may not have it in the family, but there's always a chance that it could happen to anybody. Also, there's no shame and fear of having a mammogram, just do it. By having regular mammograms, they can pick up any changes in your body and it's treatable with and better outcomes.
My name is Dr. Annapurna Nori. I'm one of the two public health medical officers at the Aboriginal Health Council of South Australia. By training, I'm a public health physician as well as a GP, and I've worked for many years, close to 20 years now, in Aboriginal health. So I've often been asked about how to make a space more welcoming for the Aboriginal Torres Strait Islander community. I've also been asked when I work in Aboriginal health by my colleagues as to how can we talk about cancer prevention with our community. And if I was talking to mainstream services, what I would say is do what you would do for anyone. Aboriginal people are no different in that everyone wants to be made to feel welcome within a service. So if you think about that and you start with that, then I think you get quite far down the line. If you're thinking specifically about Aboriginal people and you want to let them know, if you want to signal to them that you care, then a good place to start is making sure that all of your staff members, including your reception staff, who are your front line, your nurses, your GPs, allied health, everyone's gone through some level of cultural awareness training. Trust me, it does help a lot. You could then put that up there, whether you put it up on your website, whether you've got a sign up in your practice, being proud of the fact that you've gone through cultural awareness training and you want your Aboriginal community members to know that you've done that. If you wish, some people recommend that you could have the Aboriginal and Torres Strait Islander flags on display. But if you are going to do that, make sure you honour it. Don't just put the flags up and then don't follow through with your actions. Sometimes I know there are some mainstream general practices that have gone out of their way because they like Aboriginal art to purchase art and have that available as well. But none of this should be tokenistic. Everything should have meaning. If I'm now talking to my Aboriginal health colleagues within Aboriginal health, I'll remind you that you are health professionals. While we have to be mindful of cultural protocols, and as a female health professional, I'm very aware that I could be talking to a man, a very traditional man, who might be coming from remote South Australia. I'm still a health professional, and what that person expects from me is to be professional while I'm also being very culturally aware. So I might seek permission from that person to say, I'd like to talk about this. Is this something that you're comfortable with? If not, I would refer them to see a male colleague. So in the same way, if we were to talk to women, whether we're talking about cervical cancer screening, whether we're talking about breast cancer screening, if you're a male Aboriginal health practitioner or a male GP or a male nurse, it does not mean you can't talk. There isn't a rule to say you can't talk. You can certainly bring up the idea, bring up in the conversation, and let the woman decide if that's what she wants or not. Don't make assumptions about what the woman may or may not feel comfortable with. Let's talk about breast cancer screening. Right now, screening mammograms are the best way to detect breast cancer early, which is why it's important. And the ages at which it's offered is for women between the ages of 50 and 74, and it's offered every 2 years. There are women, depending on the circumstance, that could have it from the age of 40 onwards, but it's when you turn 50 that you will get information or letters inviting you to participate in the breast cancer screening, which really is about having mammograms. Now, why are we doing this video? We're doing this video because we know that the screening rates, which is mammogram rates in the Aboriginal community, is less than in the non-Aboriginal community. So whilst you have non-Aboriginal women, about approximately 53% of non-Aboriginal women do have mammograms. For Aboriginal women, it's only around 37%. So there is a big gap. You'll be familiar with closing the gap, and what we mean is we want to close the gap at every opportunity in every way to making sure that Aboriginal women have just as many opportunities to good health as non-Aboriginal women. So if you could look at screening and mammograms as a means of encouraging the woman to look after her health. Some of the conversations that I have with women around mammograms, I explain this, I explain why it's important for them to have, and I also go through how a mammogram is done and what some of the challenges that women might have with a mammogram. And this is something that my patients talk to me about. They talk about that they've been told that it's uncomfortable, it's painful to have a mammogram, and they feel a bit shame, a bit shy about exposing themselves where they're going to have a mammogram. And what I explain is that the people at Breast Screen who do the mammograms will all be women. They're all women who've had a lot of experience. They're very understanding. They give you time to make you comfortable. They're familiar with the process of how to do it, and they really are very gentle about how they go about doing it. Having said that, if you think about it, a mammogram is an X-ray. And so therefore, when you're doing an X-ray, you want to get a really, really good picture so that you can look at that breast and make sure that you are picking up a cancer or an abnormality very, very early on. In order to do that, the machine does need to make the breast as flat as possible, and that's why people can have discomfort. But honestly, it's a few minutes of discomfort for a few years of reassurance. So whilst people can have discomfort, in the big picture, it's worth it for people's health. So I would encourage you to have that conversation with women. Also understanding that many older Aboriginal women are very busy. They're looking after their grandchildren, they're looking after their great-grandchildren, they're running around looking after their family needs. So it is hard. They've also got other health conditions. It's hard for them to make the time to go and have a mammogram. Support them. So when you have conversations with them, and if they're interested, sometimes some of the Aboriginal health workers or health practitioners offer to make the appointment at that time. If somebody's interested, offer to ring up 132050, which is Breast Screen South Australia's number, and make the appointment for them. There are lots of opportunities to also bring up breast cancer screening. You will be familiar with the Aboriginal Health Check, which is Medicare item number 715. It really is a good opportunity to bring up all sorts of cancer prevention, including breast cancer screening. You could also offer it if a woman starts wanting or comes in, asks to talk about menopause or change of life, it's a great opportunity to talk about mammograms. Or some clinics and some health services have specific women's health checks, and part of that could be mammograms. But use opportunities, make sure that you encourage the women to look after their health. So rather than seeing it as something uncomfortable that they need to try and deal with, see it as an opportunity to support them in their health.
breastscreen.sa.gov.au